Hello, everyone. My name is Matt Bodrock, and I'll be giving a 10 to 12-minute presentation on colon cancer. Um, yeah, let's get started. All right, what is colon cancer? Colon cancer is that image on the far right, and what that is what they refer to as a polyp. And like any other cancer, it's essentially a tumor, and it starts out as something small, built into something big, and can potentially metastasize throughout not only the colon but the body. Colon cancer is actually common in the United States, about 200,000 cases per year. That's according to the Mayo Clinic. So it's not, by any means a rare type of cancer. Genetic genesis. So the MSH2 and MSH6, both on chromosome 2, and MLH1 on chromosome 3. Normally, the protein products of these genes help to repair mistakes made in DNA replication. If the MSH2 and MSH6 and MLH1 proteins are mutated and therefore don't work properly, the replication mistakes are not repaired, leading to damaged DNA, and in this case, colon cancer. That's according to Bethesda Colon Cancer National Center for Biotechnology Information. So essentially, what we have is mutated DNA or genes that are not corrected or destroyed, and so they build, they build up, and they start to cause these polyps, which grow and can lead to some serious health issues. Excuse me. All right, heredity or genetic. In some cases, colorectal cancer is caused by an inherited genetic condition called Lynch syndrome, also known as hereditary non-polyposis colorectal cancer, or HNPCC. My apologies. About 3%, 1 in 30 colorectal cancer cases are due to Lynch syndrome. People with Lynch syndrome are more likely to develop colorectal cancer, especially at a younger age, before 50. And women with Lynch syndrome are more likely to get endometrial cancer. Lynch syndrome is hereditary, meaning that it's caused by inherited genetic changes or mutations that can be passed from parents to children. If you have Lynch syndrome, your parents, children, sisters, or brothers have a 50% chance of having this condition, and that is according to the CDC. And so basically what this is describing is you can essentially receive colon cancer through family members, i.e. a hereditary pathway. Excuse me. That can go from family member to family member, generation to generation. But it's not always the case. Colon cancer can also be um, a combination of factors. Your family history, of course, could be involved, but there's research to suggest that your diet, your race, if you're African American, you're more likely to be or to be or to get a colon cancer. The older you are, the more likely you are to get colon cancer. So it's a multifactorial disease, like many cancers are. Effects on genes and impact. So this is according to Arvello, Sojo, and Koch, Biology of Colorectal Cancer, Center for Biosciences, Institute for Advanced Studies Foundation. And they state that indicated by the accumulation of mutations in oncogenes, genes which suppress and repair DNA, signaling the existence of various pathways through which the appearance of tumors may occur. Moreover, alternate pathways through mutation in BRAF and KRAS genes are associated with the progression of polyps to cancer. And basically, what they're describing is what I said earlier: is you have genes that are mutated that are not being destroyed or corrected, and thus they grow at their own rate, they grow their own way, and they cause these polyps. And again, they start out small and progressively build and build and build until they're very large and have the ability to spread throughout the colon and even perhaps throughout the rest of the body. So symptoms. This is from the Mayo Clinic. And basically what they describe is that there are very little to no symptoms in the early stages. That's why it's important to get, tested, as soon as soon as the guidelines come in. That way, you can catch it sooner rather than later, which is always best when it comes to things like cancer. All right, signs and symptoms can include persistent change in your bowel habits, including diarrhea or constipation, or a change in your consistency of stool, rectal bleeding, or blood in your stool, persistent abdominal discomfort such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, or unexplained weight loss. Now, what happens is these polyps sometimes can grow so big, or there's so many of them, that they create a blockage. Sometimes that's referred to in the medical field as an impaction. And the only thing that can pass by is watery stool like diarrhea. But if you do have hardened stool, they won't be able to pass at all, causing cramps, gas, or pain, even the feeling that your bowel is completely empty. Treatment. This is through the University Hospitals here up in Cleveland. They offer surgery, chemotherapy, radiation therapy, or clinical trials. Now, surgery is typically the most common with this type of cancer, where they either go in through like a colonoscopy version, where they kind of go up through your rectum and kind of tie it off, the polyps, and try and remove them that way, or they can open you up. Typically, they don't open you up. They try not to do that, but sometimes it does have to happen. There's always chemotherapy when it comes to cancer. They use targeted medications to kill cancer cells. That's something that you and your doctor would go over because it is relatively dangerous for the patient. There's also radiation therapy, which is used with chemo and surgery, and it tries to help destroy those cancerous cells. And there's always clinical trials, which are always up to the patient if they want to participate. It's not like they have to, but it's something that is an additional option for them. This case study here will kind of go over the cost of colon cancer in the United States. This is through the American Cancer Society. And this is all for 2016 numbers. So this is Tom. Tom's fecal immunochemical test was positive, indicating that he might have colon cancer. So we saw a GI doctor, and the GI doctor ordered him a colonoscopy. So he had his colonoscopy. He had 2 polyps removed. He had a lesion that was suspicious for cancer removed. The lesion was biopsied, and it was diagnosed that he had stage 2 colon cancer. Tom has had a whole bunch of blood tests and a CT scan to see the possible spread. He had a colectomy surgery to remove the lesion surrounding the tissue, and he had a lymphadenectomy to test to see if the cancer had spread. Tom also received he also received chemotherapy and supportive drugs like anti-nausea medication to help with side effects. Tom finished his treatments in May and included regular doctor's visits and blood tests. So he saw a primary care, GI specialist, surgeon, and oncologist. Now, what we have here on the bottom portion is the total health costs for Tom's colorectal cancer in 2016 were $124,425. Now, I'm kind of leaving it at that number because it depends on what kind of insurance you have, any sort of supplemental insurance. If you were offered any sort of clinical trial, if you took that, if you had no insurance, that's a pretty big number. And even if you do have insurance, that's still a large number that'll come out of your pocket eventually, depending on the type of insurance that you have. Now, colostomy bags are a huge part in colon cancer, and this is according to the Cleveland Clinic. If the surgeon cannot reconnect the healthy portion to the colon, a colostomy will be necessary. A colostomy is an opening stoma through the abdominal wall into the colon. This opening provides a new passage for waste to leave the body. The colorectal cancer patient wears a special bag to collect waste. In most cases, the stoma and colostomy are temporary. Those for some patients, they will be permanent. Excuse me. Colostomy bags are a real thing as far as what might end up happening with the patient. If the colon cancer has spread to a unique part of the colon, or if it has metastasized in the colon, they might have to remove a large part of the colon, and thus they will not be able to reconnect the colon. And because of that, you won't be able to have normal bowel movements. And what will be necessary are these colostomy bags to collect the waste. It's not ideal for the patient. And as far as home life, you now have a bag instead of doing what you normally would. And patients' self-perception of themselves typically tends to drop. However, in some of our classes, we've been learning that there is a movement for those who do have colostomy bags. That they get together, share their stories, and they find a sense of community. Now, with that, you also have the price of upkeeping colostomy bags and regular hospital visits. After colon cancer, which also add to the price of the total price of colon cancer. And so like many other cancers, it's not an easy fix as far as money is concerned or procedural wise. And one of the results might be something like this, a colostomy bag, or um, um, a change in your personal anatomy per se. But typically, colostomy bags are relatively common when the colon cancer has grown. So that's all we got for today. I guess for class we would have had questions. However, we don't have that ability. So I will just leave it at that. Thank you very much.